I'm sure you have once dealt with a patient or dealt with a colleague that is always sick because it's beneficial for their personal gain. Let's talk about malingering. Grab a piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. mosesjrk. This is a series on my YouTube channel where we look at medical topics in depth. Today we're going to be looking at malingering. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications of such videos every time I post. Grab a piece of paper and let's go. Remember, when we talk about malingering, it's an individual that actually intentionally reports certain symptoms, be it physical or psychological symptoms, in order for them to achieve personal gain. Some common external motivating factors may be things like avoidance of military conscription or duty, avoidance of work, which many people are actually guilty of, avoidance of the police, receiving room and board, and of course, obtaining narcotics and receiving monetary compensation. You have to realize that this is not a mental illness, and it's not so uncommon that I'm not going to say it in the hospital, because it does also happen in the hospital, and it's significantly much more common in men than it is in women. I want us to be able to distinguish between malingering, factitious disorders, and somatic symptom disorders. Remember that in somatic symptoms disorders, the patient is actually going to believe that they're ill and they do not actually intentionally produce or feign their symptoms. Whereas with the factitious disorders, the patients actually intentionally produce their symptoms of either psychological or physical illness, and this is because they desire to assume the role of the sick person, and it's not even done for any external rewards. Whilst with malingering, these patients actually intentionally produce or feign their symptoms for some personal gain or some external reward. Remember that patients are going to be having these multiple vague complaints that are not going to be fitting any known condition. They may often have this long medical history with many hospital stays and even sometimes different hospitals. Sometimes even the hospitals do know that this is a malingerer. They are generally quite uncooperative. They refuse to accept any good prognosis, even after extensive medical evaluation. This is what we usually do for the patients when we figure out that they are actually malingering, is one to order as many tests as possible and choose the expensive ones to start with. Then their symptoms actually tend to improve once they get their desired objective, and certain things like amnesia is the most common psychological presentation that they'll come in with. This can be followed by paranoia, it can be followed by morbid depression, it can be also followed by suicidal ideation, and even sometimes psychosis. And remember that this person is actually going to be exhibiting or even having a history of antisocial behavior. Because this is not a psychiatric condition, there is no treatment for this. But what we usually love to do at the hospital is sometimes we give them whatever they want, quote unquote, give them whatever they want. If they want an injection, probably give them some furosemide, and they'll be running to the toilet back and forth, and that will kind of teach them to never really come back and mess around with us. But anyways, I really hope you have enjoyed this video on malingering. If you did, consider subscribing to the channel, hit the bell notification icon so you never miss out on such amazing content every time I post. To Zambia and beyond, my name is Dr. mosesjrk. Until next time, bye-bye.